I wanted to share a patient story, and the reason I decided to choose the case is because this is a very young, healthy individual. She's 25 years old. She's a school teacher. She's a wonderful, very vibrant African-American lady, and she was at the time in North Carolina. So she was seen by the physicians over there. She was diagnosed with a very difficult type of cancer to treat, and the cancer was located in her sacrum, in her pelvis, and was affecting the nerves that travel through that area. And those nerves are responsible for voluntary control of the bowel and bladder functions and sexual function, as well as some of the nerves that will go down to the leg and control the leg function. That the tumor affected all of these functions. MRI scans and CAT scans found this growth, which was the type of tumor called osteogenic sarcoma. This originates typically from bones, usually affects young people in their late teens and early 20s. And this tumor is very difficult to treat. It requires chemotherapy up front, and then typically it requires surgery where you remove the tumor in one piece with negative margins. And then after the surgery, the patient will typically get additional chemotherapy. And then in some cases, we also use radiation treatment. Despite all of this, overall survival from this tumor remains quite poor. The 5-year survival is anywhere from 15 to 20%. So for a young person, this is very bad news. This patient was diagnosed in North Carolina, treated by a medical oncologist over there with 6 cycles of chemotherapy. And then she was referred to us here for surgical treatment of this tumor. This would be very complicated surgery. Cut at least half of the sacrum, dissociate her spine from the sacrum, dissociated the sacrum completely from her pelvis. So the spine no longer is connected to the leg on one side. We had to do this in a way to spare all the nerves that control the bowel function, bladder function. And then at the end of the operation, we would be left with a very large defect, as you can imagine, a hole that we had to fill in. So we went ahead and found the pelvis of a deceased individual, and we cut it to size. As a result of that, she was able to get up and walk. So we designed a 3-part surgery. The first 2 took 8 to 10 hours, and then the second one took another 6-7 hours to do. The good news is that at the end of those 3 stages of the surgery, we were able to remove the tumor in one piece. When the tumor was examined by our pathologist, the margins came back negative. She stayed here at Rhode Island Hospital for almost a month after her surgery, and then she returned to North Carolina and received another 6 cycles of chemotherapy. She has been now out from her surgery a little over 2 years, fully recovered, and there is no evidence of tumor anywhere else. And she went back to work as a school teacher. Wonderful, wonderful, very vibrant, outgoing, high-energy individual. It took really an army of specialists to be able to get her through this. I think this particular case encapsulates the type of expertise that we have here. We really have become a destination center now for all sorts of complicated neurosurgical problems. People travel here from all over the country, from other parts of the world for care. And I cannot really imagine a better place to get neurosurgical care than what we have here at Lifespan.